love that song. I can't wait for more shins, and I'm very glad you're here. Not Obamacare, though. Obamacare's days numbered. Vice President-elect Mike Pence says the incoming Trump administration will kick President Obama's signature piece of legislation to the curb right out of the gate.
The first order of business is to repeal and replace Obamacare. Obamacare has failed, and the American people have sent a decisive message to Washington, D.C.
Now, meanwhile, GOP lawmakers say they are working on an alternative to the Affordable Care Act. So what should their plan look like? What should it include? Here with a bundle of brilliant ideas, it's Brian Brenberg, Associate Professor of Economics at the King's College, right here in New York City. Bryanomics, let's break it down, my friend.
Yep.
So one of the things that insurance companies are required to do under Obamacare is make you get a bunch of coverage that you don't need, which makes it really expensive to provide and buy health insurance.
Yeah, you know, one of the most important things Republicans can do here is get rid of those benefit mandates, because look, some people just don't need to buy maternity benefits. They don't need to buy mental health benefits, and they shouldn't have to do that. You want insurance plans that are tailored to individual needs, so they can buy the plan they need, they can afford the plan they need, and that's how you get more people enrolled, by the way, the more choice that they have. So that's the #1 thing that Republicans can do here with this replacement to Obamacare.
Yeah, and if you're young and healthy, then get catastrophic insurance.
Exactly. That's what insurance is meant to do. Look, insurance is meant to cover the big things that you can't predict, and the things that are predictable, that are routine. You want to be able to put money aside to pay for those. That's why health savings accounts are so important. I'd love to see them expand the use of health saving accounts.
I would love for people to hear more about that idea, because when people say, you know, no one has a plan on either side, this is actually part of the plan that Paul Ryan has talked about, Tom Price has talked about.
I think it's so unfair that people are saying Republicans don't have a plan. I think it's what they're saying is we don't like what they've been talking about. Republicans for years have been talking about ideas that can move us more in a market-friendly direction. But it's not some, you know, silver bullet idea that Obamacare was supposed to be, right? Not some big top-down plan. It's a market-oriented plan. There are things, there are tools individuals can use to manage their own health care. And that's the way, that's the direction that you want to move in.
I mean, if you could make health care like Amazon. So you go on Amazon, you put a product in, and then there are a bunch of different vendors that sell the same product for slightly different prices, and you get to choose how fast you get it and how much you're going to pay for it, essentially. How nice would it be if you could choose a plan that's not necessarily in your state, that it gives you the coverage you need for what you can afford to pay.
You know, there's a bias out there that assumes health care can't operate that way. And I know that
everything, I mean, look at Uber. And the sharing economy, everything can operate that way.
And that's the point, is that this bias is unfair. Look, let's create the opportunity to see what entrepreneurs can do in the healthcare space. I don't think there's any limit to how innovative we can be, but that can't happen in a system where you have centralized federal control of people's health care, when you have coverage mandates that people don't need, when you have individual mandates that require people to buy insurance they don't want. Amazon works because none of those things exist in an Amazon world. Let's move to a system where we can start to approximate that a little bit.
And let's get regulation out of the way when it comes to people interfacing with plans and really having a choice and a say, because what's happened is we've lost so much control that, you know, there's actually this sort of mass depression around healthcare, because going to a doctor is now a pain, and it's more expensive than we were told.
You don't know your doctor. And look, for a lot of consumers, we don't even know how to be consumers of healthcare anymore, because for so long we've been shielded from the process of making decisions. That has to change. If that doesn't change, you will never fix healthcare. So that's why some of the things we're talking about here are part of the solution.
All right, and government assumes we're dumb. That's why we have to limit government, increase choice. Brian Brenberg, you're awesome. Thanks for coming by.
Good to be here.
Happy New Year.
Happy New Year to you, too.